Hello, and thank you for joining us for today's webinar on Systems Thinking for Public Health, Aligning Stakeholders for High-Impact Action. Today's webinar is made possible through a collaborative partnership with the Iowa Public Health Association, Engaging Inquiry, and the Midwestern Public Health Training Center. Before I introduce today's speaker, though, I want to go over just a few logistical items. So at the end of the webinar, we'll have a question and answer session, and you can submit questions at any time during the presentation by using the Q&A function on your screen. There's also a chat function that you can use. It looks like a talking bubble with an ellipse in it. So we're going to go ahead and start the webinar today. And today's webinar, just to let you know, will be available on demand. You'll receive a link to the webinar in an email within the next few days. At this time, I'd like to introduce today's speaker, Bailey Goldman. Bailey has spent her career at the intersection of public health research and practice, engaging community systems to support the best health outcomes for all, with particular consideration to the most vulnerable members of a population. Bailey is passionate about health as a human rights issue and has worked across disciplines to improve community cohesion and reduce barriers to care. She has led research and development initiatives in India, Peru, Honduras, as well as within the United States. Most recently, though, Bailey worked as a health education team lead for a local public health department serving 2 rural and economically disadvantaged counties in North Carolina. In this role, Bailey was responsible for grant acquisition and management, community health assessment, and providing strategic vision for the health department's community-based initiatives. She facilitated a high-impact coalition of community leaders to achieve collective impact on systems influencing childhood obesity. Bailey earned her master's degree of public health from the UNC Chapel Hill's Gilling School of Global Public Health in maternal and child health. Bailey, I'm going to go ahead and turn the program over to you now, and thank you.
Thanks so much, Lori, for that great introduction. First of all, I'm really excited to be speaking with you all today, and we have an ambitious plan for 1 hour. But I want to be sure to leave plenty of time for discussion. So please be sure to be making note of any questions or comments you may have along the way. So today we're going to start by getting to know each other a little bit. I'm definitely more used to working in person with people. But with the big group, we don't have the opportunity. So we'll try some different approaches to doing that. Then we'll jump in and really start to build the foundation around the what, why, and how of systems practice. Then we're going to demonstrate how a systems approach can work to build strategic partnerships to enhance the impact of public health. And then, as I mentioned, be sure to have time for questions and to share an upcoming opportunity to learn and test some of these strategies. So Lori gave a great introduction, told you most about me, but I think one of the things I would like to do is just really situate myself as a fellow public health practitioner. As Lori said, my background is in public health, and I just continue to face in my role in a local public health department, being told we needed to use evidence-based practices. We wanted to build these collective impact coalitions, utilize continuous quality improvement strategies, and all of that is exactly what we should be doing. But how do we keep hitting these roadblocks and not seeing the impact that we want to see and that our community really deserves and expects of us? And so after experiencing that over and over, I started looking around for what could help achieve some of the impact that we were looking for and address some of the challenges that kept coming up. And that is how I found systems practice. And then really felt a calling and a responsibility to share that back with my colleagues in public health. So I am grateful to be able to be doing that with you all today. Okay, so we're going to try some fun with polling. If you have your cell phone handy, you can use this text messaging component, and you'll join the poll by texting Bailey G007 to the number 22333. Or you can follow this link on your computer to join the poll on your computer. So I'll give everyone just a minute to do that. And then we're going to jump into a little Q&A and see who our audience is today. So as you're getting started, I want you to think about what is your current level of experience with systems thinking? Are you still a little bit skeptical about systems? That's okay too. Are you really curious? Have you had a chance to explore some of these theories, but you still kind of feel like a beginner and you have a lot more you want to learn? Or are you really a champion of systems thinking, out there doing this work, exploring this practice, and sharing it with others? Wow, this is great. Okay, so good. We have a good range, and it sounds like everyone is at least pretty bought into the opportunity that systems thinking offers with public health. So one more here, and if you can see, now we have one more poll for you. How do you hope to use the knowledge and skills you build in this webinar? I'm sure that you are already impressing your friends and colleagues with your brilliance, but hopefully we can help you do that a little more as well. Are you looking for a tool for your toolbox? Or do you have a really specific project that you're hoping these strategies can support? And we know everybody just loves webinars, so that may be a given. Great. Thank you. That's good to know. And hopefully we can definitely provide some tools for your toolbox, and then also some real strategies that you can employ. Okay. So now if you could type into your phone or computer one word that you could think of to describe the value of systems thinking in public health. And you can offer multiple words. Great. Connectiveness, innovative, impact, equity. That's great. Cooperation. Necessary, wonderful. Empowering. These are great words and so integral to the work of public health in general. All right, thank you for letting me get to know you all a little bit, where you're coming from and what your goals are for this webinar. Okay, so I'll go ahead and start with some of the fundamentals of what we call a systems practice. So first of all, the world we live in, right? In public health, we experience and live every day in this complex, messy environment where we see solid evidence not often being translated into progress in policy and outcomes. The time that it takes to translate research into practice is long, and it's hard to do that. Important actors don't communicate or collaborate well. We build those silos, and they somehow seem to get taller and stronger. The competition for resources grows, and the resources available, they don't always fit the need. I know this was a big one for me in my public health experience where, you know, prevention efforts and community-based work didn't have the funding that we needed. And so we were grateful for whatever dollar we got, even if it wasn't exactly what was the best fit for our community. And along the way, as we're going, new challenges keep popping up. I'm sure that you all can relate to that. And so one of the metaphors that we use a lot in our systems work is the idea of understanding the spectrum of social issues. So there are clock type problems and there are cloud type problems. Clock type problems are pretty predictable and they're rational. It doesn't mean they're not complicated, but they are well understood. There's a robust toolkit for diagnosing the problem, and practices for analyzing and engaging that problem are relatively agreed upon. The perfect example is the clock, right? This could be a really ornate, complicated Swedish clock with tiny gears and really specialized tools. But the tools are there. You know how to fix the clock, and you all know when the clock is fixed. It begins telling time again. That's something everyone can agree on. Cloud type problems, however, are much more disorderly and irregular. They're ever evolving, they're interrelated, and the solutions that exist are often a matter of value and stakeholder judgment. So examples of this could be any of the public health challenges of our day, right? Think about teen pregnancy prevention, promoting healthy lifestyles, addressing opioid abuse disorder, or reducing health disparities. These are all really contentious issues that people have very different perspectives on the right approach and what success looks like. So in public health, we operate in the cloud. And the challenge for us then is resisting the urge to apply clock-like fixes to cloud-like problems. Instead, we have to work to foster the mindsets and exercise those methods and tools for understanding and effectively engaging the cloud. Unfortunately, when all you have is a hammer, everything looks like a nail. So from that need, systems practice has evolved. And systems practice offers the mindsets, processes, and tools that allow initiatives to effectively address adaptive challenges in complex environments. The systems practice really takes the theoretical ideals of systems thinking and offers concrete, actionable tools and methods for bringing them to practice. Just to give you a few other key terms that I will be using a lot throughout this webinar. Of course, when I'm talking about a system here, I'm thinking about a diverse set of parts that interact with each other and their environment in ways that are dynamic, have a lot of action and movement and change, and so they're hard to predict. However, they can still be studied, mapped, and influenced. I'm also going to talk about leverage, which is the ability of a relatively small intervention in a system to have a disproportionately large impact. From those leverage points, we find leverage opportunities, which are made up of related factors, connections, and dynamics that together can impact the equilibrium of the system as a whole. So in systems practice, we've kind of fostered these 4 mindsets that we have found to increase effectiveness when working on adaptive problems in complex environments. So the first one is really important, and I think it's also really great framing for our stakeholders and our funders. And that is the idea of seeking health and not just mission accomplished. We know that these problems, being cloud problems, are always going to be changing and evolving. There's rarely a problem in public health that we will say, check, solved. We can see that in things like the measles outbreak on the West Coast, where that was something we thought was a resolved issue, and here it is emerging again. A big part of that is being able to see the patterns underneath the problems and not just the problems themselves. I think this is a really easy trap to get into for driving directly at a problem without understanding the underlying forces and factors that are creating that environment for the problem to take place. Another fundamental idea is that we really want to work within the system to unlock the change and not impose it. This allows us to use the forces that are working around us to bring the system to greater health, instead of working in opposition to those forces. And of course, along the way, we need to plan to adapt, not just stay the course. This planning ahead allows us to really be able to always look up around us and sense what's going on in the system, and be able to use what we see to achieve the greatest impact. So we see this challenge of building strategies that are up to the demands of a complex system in which we work. And we do know that to be successful, our approach will need to align stakeholders across the system to develop and deploy strategic action for positive social change at scale. And systems practice provides an opportunity to foster clarity on purpose, process, and approach across those stakeholders. It allows us to build capacity across the system to sense itself and to adapt towards greater health. A big key there that has been a big part of public health lately is building resilience in the system. So the systems practice journey talks about starting by gaining clarity, really developing a deep understanding of the system and building the map to visualize those key forces and patterns driving system behavior. Once we have that systems map, we use it to be able to find those key leverage points for engaging the system in ways that can help push it towards greater health. Once we understand those leverage points, we can use them to act strategically and as a foundation for designing and implementing an approach to build on those opportunities. And then, of course, along the way, continually learning and adapting and translating that knowledge back into our understanding of the system. This is another way that we kind of describe that process. We talk about, for the gaining clarity, building a theory of context. And in that theory of context, we're asking the question, how does the system of interest actually work in its current state? And that's a really important distinction, because in public health and in people who are genuinely wanting to help and improve the system, it's hard not to see that aspirational state of health that we're working towards. But we really want to take a breath and understand where we are currently operating, understanding those critical dynamics and patterns that are driving systems behavior. So answering those questions helps us build the theory of context. And the next step after that is to answer the to look at that map, that context that we've built, and ask, where are the opportunities for outsized influence on the equilibrium of a system? So thinking about moving that whole system to a state of greater health. And that from that question, we build a theory of change. With those leverage points in mind, we can then ask, how might we best apply our resources and comparative advantage to engage these critical leverage opportunities? And then, of course, along the way, being able to test new ideas, learn from them, and adapt. Okay, so that all sounds great, but what does it look like in practice? So in the gaining clarity stage, we're really taking the time to listen to the system. And for this, we really use a community-based participatory action research model, where we are engaging a breadth and depth of key stakeholders and providing the opportunity for sharing and listening, and then visualizing the connectivity across the system. So really fostering a sense of shared fates within the key actors around the system. So within our process, we are continually zooming in and out. So in this first stage, we identify key themes that are enabling or inhibiting that vision of a healthy system. Next, we zoom in to explore the cause and effect of each theme. And for this, we use what we call an upstream-downstream analysis. From there, we use that analysis to build causal feedback loops for each theme. So it's really finding the really influential stories within each loop and how they feed into each other to continue the cycle that enables either that good thing to happen in the system that we would want to strengthen, or also perhaps that challenge in the system that we would want to be able to address. The next step after, and I just want to note here also that the community builds all of this data for us. All of the data that we use to build the systems map comes from the community. And that's a really wonderful opportunity to demonstrate to your stakeholders how their input and their voice is directly contributing to the action that you take. So once you have all of these loops built out from your workshop, it's our work to zoom out again and discover the connectivity across all of the various loops and stories that came out of the workshop, and really thoughtfully and carefully weave them together to build a cohesive map. And this is an example of a map that we built with a team out of Omaha, and we'll come back to them a little more later as well. But this dynamic systems map really allows the community to see the patterns versus the problems. It allows people to surface and interrogate assumptions, to understand how people are acting and the way that beliefs drive behavior. I know in public health, what we do is driven by data and by evidence, but that's not always the case in the world around us. So having this tool to really be able to see and understand how those driving behavioral forces are influencing the system can be really powerful. The way this process is set up is also to give the opportunity for stakeholders to work shoulder to shoulder versus across the table. So really giving everyone an equal voice and an equal piece of the system. It fosters shared ownership and shared opportunity, really taking away any blame or finger pointing. And most importantly, it helps the system to see itself as a connected system, to really build that sense of shared fates. So once the system's map has been built and it has been agreed upon by the community members, then we reconvene to work together to find those leverage points. If you can think of the systems map as a road map, the leverage map is the topographical map. So it allows the areas of energy and opportunity to really rise to the surface. Again, in this process, we're zooming in and out to look at the system and see where is there energy and opportunity. Where are things really stuck? If that stuck point is something we need to address, where are the places in the system that we can target our action that will in turn influence that stuck point? So being able to see and visualize how we might engage and amplify our efforts. This is the same map as the previous theory of context, but it is overlaid with the leverage opportunities so that you can kind of see where input is directed and how they have hypothesized that to translate into action. So this process allows the community to find those high leverage opportunities to amplify, disrupt, or connect areas in the system to achieve overall systems movement. From this process, they're able to frame a change hypothesis, build, strengthen, and influence networks, and identify areas for monitoring and learning. So you can see in this visualization how you identify areas where connectivity exists on the different forces and factors in the system. So you can easily test where your impact should be showing up, and if you see the level of influence that you're wanting or not, what you might want to do to change your action. So I'm just going to take a little pause here to read a quote from Oliver Wendell Holmes. I would not give a fig for the simplicity this side of complexity, but I would give my life for the simplicity on the other side of complexity. And I think for me, that was just a bit of a reassurance that all of the work that we do to take a step back and understand that understand the complexity and the system that we're working with is really for achieving that greater vision and reaching that simplicity on the other side. That it really does exist. There is a light at the end of the tunnel. And part of that hope in the face of all of this that can feel very overwhelming is how we view systems. We really take a positive outlook and use a lot of appreciative inquiry in our practice, and that's based on the belief that systems are not broken. They are perfectly structured to produce the behaviors and outcomes that they produce. And that means they also hold everything that they need to achieve the positive changes that we're hoping for them. Also, systems change best when they change themselves. So how does change happen? through a collective understanding of the patterns underneath the problems and building self-sensing capabilities within the system. So to show you some examples of how public health has embodied the chief health strategist role and really been able to leverage the resources available in the system, I want to talk through a few examples here. So this is the team that we worked with in Tarboro, North Carolina. That is a really rural, underserved community that has experienced significant natural disasters and just was really struggling to achieve the outcomes across the board around health, economic development, employment, education levels that they really wanted for their community. And so one of the challenges that the community really rallied around was trying to understand the high levels of adverse childhood experiences in their community and the impact of unaddressed trauma on achieving those outcomes. So they worked together really hard and tirelessly and built a fantastic and highly participatory systems map. And then again, came back together to identify these 3 leverage points of increasing knowledge and awareness through training, building the ability to self-determine within their residents. So the ability to be the leader of their own fate. And so this is building those social and emotional skills, having the chance to fail and try again in a safe space. And then finally, the ability to reconnect with the community. So one of the really fantastic things that we saw through their participatory approach was that they were able to foster really strategic partnerships around their community, and different parts of the community took leadership on each of these key areas. So in the area of training, the Regional Training Center actually worked to pivot their efforts to instead focus on supporting awareness and outreach on the impact of trauma on children. And so that was across social determinants of health, being education, employment rates, and then of course health as well. On the goal of improving the ability to self-determine, the school district was able to secure funding for capacity building and trauma-informed practices. And I know for them that was a real success in itself, because the school system was really hesitant to seek out grant opportunities. So the fact that they were so engaged and willing to reach out and try that was in itself a success. But beyond just doing that, when they did host the training and allocate staff time to be trained, they also made those trainings open to the public. And that really demonstrated a real understanding of their situatedness within a larger system and how the school was not operating in a vacuum. It really needed to work with the other actors in the system to collectively improve the outcomes that they were seeking. The next piece was around building opportunities to reconnect. And one of the really special partners that they were able to foster through this process was with Tyson Foods, which is a major employer in the area. And they quickly became a real advocate for this process. And I think it was a lot because they saw both how the role of unaddressed trauma was impacting their ability to hire quality employees and retain them. And they also really saw an opportunity to improve the economic development and stability of their community. So being part of the process, they actually work to seek input on their hiring and supervision structures so that they could be more trauma informed and hire more, maybe perhaps non-traditional employees, but then really give them the support to be successful in their role. Another really important piece through this process was that they integrated community individuals who had real lived experience across the whole mapping and leverage finding process. And the result was that the community collectively decided that they wanted to build leadership opportunities for these individuals. They really saw the value that they brought to addressing this issue and wanted to give them the platform to share what they had learned and to share the resiliency that they were able to grow with other members of the community. Okay, so another example of this is our work in Omaha, Nebraska. And this, again, was with a local public health department, but they were working on housing affordability as a key social determinant of health. And again, not really a traditional health department project, but something they really saw as on the horizon for their community as impacting public health outcomes. And just to let you also know, this project was led by Andy Wessel, who will be the keynote speaker at the Governor's Conference on Public Health. So I don't want to give away too many spoilers, and he will definitely expand upon this a great deal in his speech, I'm sure, but he is fantastic if you have the opportunity to come see him. So again, they went through this very participatory process and again really worked to engage representatives from across the system to be part of this process. And I think the outcome, especially from a public health perspective, you know, getting the private sector involved is a real, you know, one of those things where we all know we should be doing and it's going to be a benefit to do, but it's really hard to actually have happen. And through this process, Andy was really able to do that. One of the leverage points that they identified collectively was this need for addressing the missing middle housing. And that's really the housing that offers a range of affordability levels so that families are not required to either buy housing way above their price range or way below, but have something that is affordable for everyone. And so through that process of identifying and working in that leverage opportunity, a prominent local bank actually decided to host conversations about housing affordability and the role of lending in building equitable cities. This was a big driver that the workshop participants identified, you know, having developers and real estate owners in the room together with also legal aid advocates and community rights advocates was that these developers were really struggling to make affordable housing work for their budget. So having banks agreeing and having conversations about how they can make those lending processes for developers easier so that it makes financial sense for them to build more middle range housing was a really wonderful new development. The second leverage point they identified was the need for improving housing stability supports. And to address that, county leadership decided that they needed to begin working to expand the role of the local health department and design a framework for ensuring safe, healthy housing opportunities. The systems map really brought to light the fact that the maintenance and reinforcement processes for housing really promoted kind of a slumlord approach, when in fact, with additional supports, everybody across the cycle, both between the landlords and the tenants, could really achieve healthy housing options as well as financial stability for the owner. The third part of this kind of cycle of leverage opportunities was the idea of inclusive prosperity. This was really something where we could watch these different leverage hypotheses build on each other to really foster that healthy system. The idea of inclusive prosperity was something that really stuck with the Heartland 2050 collaboration. And so they really adopted the systems map to help them inform their cross-sectoral collaboration tasked with driving thoughtful and equitable development. So as you can see, when you bring the community and the system together, those stakeholders are capable. They're capable of taking on these problems and the solutions that they require. So what are the capabilities that a system needs to be able to respond to its own challenges with vibrancy and resilience? It needs to be able to see itself as a complex system. It needs to have the ability to make meaning and sense of the challenges as they emerge. The ability to align around a plan for action, and the ability to test, prototype, learn, and adapt along the way with support from the system around it. So while we are leaders in the critical health issues of our time, they're not ours alone to carry or to solve. By engaging the strategic partnerships around a common systemic strategy, we bring transformational change within reach. And so, on that note, I want to do one last poll with you all to get a sense of what you see as the area of greatest opportunity for taking a systems approach in public health. So if you can go back to your phones or to your computers and type in any words that pop into your head. Cross-sector, great, maternal health, child health, teamwork, that paradigm shift. That's great. One of the things that's really wonderful about engaging these partnerships along the way is you're getting them to help you build the data that you need to understand context and then build your theory of change, but you're also teaching them and building champions for this work. So that is a really wonderful secondary outcome that has shown to be really meaningful. Equity. Upstream. Great. Non-programmatic. Yes. Collective impact. Racial. Great. Yeah, we've really found this to be a great tool for tackling difficult, contentious conversations. So I love that you all are seeing those aspects as well. Great. Well, thank you all so much. And I think that was my last slide.
All right, if you all have any questions, please feel free to put them in the chat box at any time. We do have one. Does software exist that will build the theory of context?
So yes, for the mapping, we use Kumu, K-U-M-U, and it is a really great software. We really use it also as a data collection and management tool. So for each of the loops that you saw in the theory of context map, you can click on the title and there will be a written outline of the story that was underneath that loop. So again, it's also something that you can share easily with your stakeholders, and they can directly see where this information came from, and how their input was actively used to build your strategy. It's also a really great thing too, because if people come back at you and say, why in the world would you want to do this? You can say, well, actually, it was the community and this is what they said. So that's helpful as well.
Thank you. Do you have a step-by-step approach to mapping?
So the actual mapping itself, I guess I would say building a map is really a muscle that needs to be strengthened, and it takes time and iteration and really going back to those community members and testing what you've written. But it's something that is a collaborative build. So I think it's one of those things where, you know, over time you build your own relationship with how you design a map. But we do definitely have concrete strategies and ways that we coach teams to be able to do that. Kumu actually has a lot of great online tutorials and web videos that can help you do that. It's a really great tool. And there are also other types of maps that they offer as well. So actor mapping and things like that. So we don't have, you know, a real specific step-by-step guide for building a map. It's more of an art form, I would say, than a concrete process. But we do have a step-by-step process for gathering the data from the community. So I hope I got your question right there.
Are there any other questions? I just put the link to the Kumu in the chat box, so everyone should be able to see that and click on it if you're interested.
Bailey, this is Lori. While we're waiting maybe for a few other questions to come in, I have one for you. So would you say that this is scalable? Like if you want to use this and test this out on a smaller scale, say internally within your organization, could you do that before you start on a bigger challenge?
Absolutely. We have definitely gotten a lot of great feedback from the partners that we've worked with around different ways that they've integrated some of these, more discrete pieces of the process in other areas. So one of the things, and it's fun too, because you'll start to see stakeholders in your community doing this as well as they get more engaged in the process. But being able to understand issues as causal patterns is something that really sticks with people. So you'll see people in a meeting talking about a challenge that they're having in clinic flow or with getting parents to come to school board meetings or, whatever the case may be, and being able to think about the pattern underneath that challenge, even if it's just one loop or maybe two connected loops, we've gotten feedback that that's a really helpful way to think about challenges that people are having at whatever scale and being able to address it more effectively. So that's one. Also, we've gotten really great feedback about the upstream downstream analysis. And again, that's a tool that really helps with that mindset shift of seeing patterns and not problems. So anytime someone throws up a problem as something that is just going to be impossible to address or a real roadblock towards achieving the goal that you're working on, put it at the top of the page, and on the left side, start listing all of the things that are causing that challenge to exist. And then on the right side, list all of the things that are a result of that challenge. And that simple act just allows people to start understanding the way that problem is situated in a larger context. Any other questions?
Yeah, we do have a couple more. Does your work stay in the qualitative space or does it dive into quantitative space? So this commenter, this questioner says it seems like there's value in soft systems modeling techniques, but she is a bit overwhelmed by quantitative methodologies.
Yeah, so these systems maps are really designed around complex social challenges and understanding the behaviors and the ways of thinking, the values that drive system behavior. So it mostly exists in the qualitative space. However, it is a really useful tool, especially when you have stakeholders who have a hard time valuing quantitative data, to be able to pair that evidence that you have, that scientific evidence that you have, with the qualitative stories that are coming from your community, and really giving a living example of how that's showing up in their system and influencing the work that they're trying to do. So while the map really does, as the writer said, kind of mostly live in the qualitative space, there is an opportunity to layer the quantitative data to help you make that compelling pitch, right, to get folks on board and really align your stakeholders around a common vision.
Thank you. So we'll do one last question here. Is it advisable to use the process to create a universal model within one discipline, like NGOs engaged in global community health, or should every organization in every context use the iterative process?
I hope that I have the question correctly, but I think I would definitely say that when you're building, well, I guess it depends on the frame of your inquiry. If you're trying to understand how to best achieve an improvement on some, community health outcome, you would want to bring in all of those NGOs that are working in that space together to understand how they're operating, the resources they have, the challenges they're facing, the experience of the community population that they're working with. So kind of bringing that system together instead of doing individual internal maps. If you want to understand how you internally as an agency are operating, that might be a little bit different. But if you are working to influence a larger, more systemic challenge, then you would really want to bring all of those parts of the system together, including the population being one you're seeking to serve, to build a map together.
I think that was our last question, Bailey. I really thank you for introducing us to systems practice and for giving us those wonderful examples of the role that public health plays as a chief health strategist with systems practice. We just thank you all for joining us and thank you for your interest.